Now, I don't know if it was a thrill for the Republicans yesterday when the effort to expand Medicaid in Michigan passed. Democrats were applauding, Republicans were split. Goes to the Senate now. What happens next, and why is it important?
Well, I think, I remember I was going back and looking at a speech that Governor Snyder gave in September of 2011 where he talked about health and wellness. And this is just really kind of completion. But last night, 55 votes were needed to get that passed, and 76 people voted for it, 28 Republicans and 48 Democrats. That's a pretty good bipartisan vote. 31 voted against it, and now we're on the way to the Senate next week. And what's important about it is that it offers over 400,000 people in the state over the next 3 years a basic health policy. These are people who make between $8 and $12 an hour, who basically are using emergency rooms right now, don't have physicians, and now they're going to be able to get engaged with a physician and get well.
So why would you vote against something like that?
Well, I think a lot of people don't like Obamacare. They think by defeating this, they're not supporting the Affordable Care Act. Well, the Affordable Care Act was passed over 2 years ago. People, thought when if Romney was elected, they could change that. That didn't happen. And if Michigan wasn't going to act on this, the penalties that Michigan would pay into this would be a donor state to other states. In fact, Michigan would pay about 3.5% of the total funds that the federal government wants to fuel this Affordable Care Act. So this way we become a sharer in that and reach hundreds of thousands of people.
So the members of the legislature, the Republicans for the most part, who voted against it, did it on principle.
It was a lot of principle, and these are good people, and I think we're going to face the same challenges in the Senate. I'm optimistic. There's going to have to be a lot of education, the editorial support, the comments from the interest groups, the Hospital Association, Small Business, the Michigan Chamber, the big insurance companies have all been supportive, community mental health boards, and so this is really the right policy to do. And the part that I always get excited about is that healthcare is a huge economic engine in the state, and people come to this state because of our strong health infrastructure. And if we want to grow Michigan, we need not only infrastructure in the community, but we also need healthy employees. And what better? I mean, there's 1.2 million people uninsured in this state, and just that vote last night will bring insurance to 46% of the people who are uninsured in the state, and over 500,000 of those people are working but have no health care coverage.
Does it cost the rest of us anything?
Well, there's about 26 taxes and penalties that were going to go into place. Many of these now will be alleviated. And also, the federal government was beginning to decrease its amount for uncompensated care to hospitals. This will assist the hospitals. And quite honestly, Michael, this bill has reforms in it. These are for adults. These aren't for kids. In the current Medicaid program, half the people on it are kids. A lot of people are in nursing homes. But this is for childless adults who don't have health care, under 133% of poverty, and that are people individually who make less than $15,000 a year. So this is going to make a huge difference in our health infrastructure and the health of this state.
And people should understand, too, that Governor Snyder, who is a Republican or was elected as one anyway, is in favor of this.
And he recommended in his budget in February of this year.
And he's insisted his way of going about governing has nothing to do with being Republican or Democrat. It's what's right for Michigan. That's his mantra, isn't it?
That's his mantra, and he's been consistent in that. And this was a great team effort, and I appreciate his support for health and wellness of the people of this state.
Are you